Alright, so I figured since all my videos are random crap that you probably don't watch, or if you have, I'm sorry that I wasted your life. But, they're pretty random and totally stupid and just not funny. Yeah, how do I describe that? Boring! But I thought I'd make a kind of more serious video about acne. And I know it's like, haha, acne? What? Yeah, no, I'm gonna talk. This is reaching out to the people who have bad acne. Because ever since I was 8, I've had extremely bad acne. Like, my face is scarred. And I still have redness and stuff. But it's gone. But what I want to say is that there is help and there is hope to clear your face, because I had probably one of the most severe acne cases that my dermatologist has ever worked on, and she figured out how to clear up my face, so I was like, yeah, great. But if you're wondering what I use, and if you see a dermatologist and you've tried everything, like, I literally have tried everything. Face washes, gels, creams, you name it, I've tried it. I really have. We've talked about so many things, me and my dermatologist. But we finally decided that I should go on a miracle pill. Well, no, never mind. That's something else. But we decided that I should go on Accutane. And Accutane, they do have a generic brand, and it is called... It's called Clairvis. And here it would be. I don't take it anymore. I have extras because I forgot to take them sometimes. So I've got an extra couple boxes, actually, which is kind of bad. But, this is for really severe acne cases, and my acne was so bad. It was disgusting. Like, I didn't get made fun of, and I'm surprised. It was so bad. Like, I don't even know if you could just picture the moon on my face. There's a lot of, like, pimples. It was gross. But, after all I tried, my doctor put me on this. And what this is a miracle, basically. No, we started off with me on 20 milligrams of it, and then we didn't work, so we went up to 30 milligrams, and I ended up taking one pill every day. Then after a couple months of that not working very well, like, it worked better, but didn't work as well, they bumped me up to 60 milligrams, where I was taking only 2 30 milligram pills every day. And eventually, after 8 whole months, my face was cleared. And you're probably sitting there like, man, I could clear my face up faster with, like, Clearasil or Proactive. Couldn't get the name. But things like Clearasil, Proactive, Neutrogena, I've tried them all, except for Proactive. Yeah, it doesn't work. It really doesn't. I mean, no, it really doesn't. Okay, this stuff, ooh, just had a pill pop out. Didn't realize it was open. This stuff is very expensive. But if you have the right, coverage, meaning, like Blue Cross stuff, you should be fine. If you've got crappy coverage, I would suggest that you probably don't jump toward this. It honestly did help a lot. If you look, my face is completely clear. And I have been off of Accutane for about 3 months now, I think. And it really, like, I haven't had one pimple. Even when it was that time of the month, yeah, I didn't break out or anything. So I really would suggest talking to your dermatologist about this awesomeness. And again, 8 months, really not that long. It kind of went by faster than I thought. The thing you have to do is every month you have to have your blood taken so they can check to see if it's affecting anything like your health. The only thing that happened with me was my cholesterol went up a tiny, tiny bit, but nothing extreme. It causes serious birth defects. For female patients, yeah, for anyone who's a woman who takes this, I would suggest that you don't take it while you're pregnant, because if you look at all the pills, it's got a pregnant lady with an X through it. And I guess here's what a baby should look like, and then that is what your baby will look like if you take it. So, defects that you can see, such as low-set, deformed, or absent ears on your child, wide-set eyes, depressed bridge of nose, and an enlarged head and small chin. Okay, your child is going to look like, if you've ever seen the movie Conehead, I don't even remember that movie. I don't think I saw it. I think I saw like 5 minutes of it. But they're going to look like that. They're going to look pretty crappy. You're going to have ugly children. So don't take it if you're pregnant or planning on getting pregnant anytime soon. Yeah, I'm going to read some of it to you. And I know this is a long video, but again, it's really important. If you have any questions, ask your dermatologist. They will be helpful. I swear they will. You must not take Clarivis if you are pregnant, because any amount can cause birth defects. And even if you take it for a short period during pregnancy, it will cause serious birth defects. Okay, you may not become pregnant 1 month before, during, or 1 month after you stop taking Clarivis. So don't get pregnant anytime you're doing it. Wait, what? No, okay. That didn't come out as I planned. Alright, sounded better in my head. You will not get your first prescription for Clarivis until there's proof you had 2 negative pregnancy tests as instructed by your doctor. And I myself am very young, and I've never experimented with sex because, again, I'm young, and I still had to take a pregnancy test. So if you have gotten your friend and you can become pregnant, then you have to take a test. It's just what happens. And you have interacted with the iPledge system, which is a book you get and a card you get and this online thing that is all about Accutane. It's great. You have to answer questions every month and make sure that you're not being like any different, because some of the side effects are depression, and it's the only one I can remember, but that one's not very good. You obviously don't want depression, so talk to your doctor if you do get that, because that would just be horrible if you had it. You cannot get monthly refills for Clarivis unless there's proof that you have had a negative pregnancy test conducted in a lab every month during Clarivis treatment. So they will take your blood every month, and I'm pretty sure that they test your blood and get a pregnancy test every month while they check your other stuff like your cholesterol. Even the best methods of birth control can fail. Therefore, 2 separate effects forms of birth control must be used at the same time for at least 1 month during, before, and 1 month after you take Clarivis. So you need to have at least 2 birth controls, I guess that's what it's saying. You need to be covered, basically. Stop taking Clarivis right away and call your doctor immediately if you have sex without birth control, miss your period, or think you are pregnant while you're taking Clarivis. If you think you're pregnant in the month after you stop Clarivis treatments, call your doctor immediately. Because then again, your baby could look like an idiot. Some defects that your baby may get that you can't see are the brain, heart, glands, and nervous system will be messed up, and I am out of time. But talk to your doctor because it really does help. Bye.